So today we're going to be going over pressors, and this will be a little bit more of a lengthy discussion because we will be using this in the field in addition to doing patient transfers. And I happen to like dealing with these because once you understand the underlying principles, it's actually pretty cool how you can analyze each drug that you're using. All right, so these are the four that we'll be talking about: dobutamine, dopamine, epinephrine, and norepinephrine. And you probably are familiar with all of these, except for perhaps dobutamine is used a little bit less commonly. I've actually never used it, but it has some unique features that call for its use at certain times. The underlying ones are endogenous, or are hormones that are created by the body and found naturally. Dobutamine is not. In general, when we are transferring patients who are on these medications, we want to make sure that we do very frequent vital signs because most of these cause hypertension and tachycardia, and dobutamine can cause hypotension, believe it or not. And certainly all of them are arrhythmogenic, which just means they can cause rhythm problems. So this is kind of the slide I want to spend a little bit of time on because each of these medications to a different degree affects these different receptors in the vasculature. So that includes the heart and the arteries. Those receptors are beta 1, beta 2, and then alpha. And there's 1 and 2, but we're really not going to deal with alpha 2 receptors. So beta 1 receptors actually affect the heart. These are the ones that cause increased heart rate, and they also increase the strength of contraction. Increasing the heart rate is called chronotropy, and increasing the squeeze or the strength of the pump mechanism is called inotropy. And beta 1, things that affect beta 1 are the most likely to cause rhythm problems too. Beta 2 causes vascular, or specifically arterial dilation in the peripherally, like in your muscle tissues. And then lastly, alpha 1 causes just the opposite, really, vasoconstriction, and primarily in your muscles throughout the body, all the capillary beds and all the end points of blood flow to the organs. So the way I like to think about it, epinephrine is the main body catecholamine that we're used to thinking about, adrenaline. And it affects each of these things. And if you think about why, it really helps you kind of understand each of the different receptors. So if you are, in a room with a tiger or something like that, or you're in an alley and you're about to get robbed, you want a lot of epinephrine around, and you're bound to have it. And what that does for you is, because epinephrine stimulates beta 1, it causes your heart rate to increase. And not only that, but it causes the strength of each contraction to be greater. So it gives you essentially more blood flow. It causes beta 2 activation, which increases blood flow to all of your muscles in case you need to fight, run, whatever. And then its alpha 1 activation causes kind of just the opposite of beta 2, actually, but it causes in other areas, like your gut vasculature and your kidneys, it causes constriction of those arteries so that you can divert blood flow to the muscle tissues, which you're going to be utilizing for the situation where your epinephrine's high. So, and if you know these things, and you can actually pick the agent according to which of these receptors the specific agent activates. So the first one we're going to go over is the one that you probably have the least familiarity with. It's called dobutamine. And it primarily activates just beta 1 and beta 2. It has very little alpha 1 effect. So if you think again about what each of those receptors do, beta 1 causes increased heart rate and increased squeeze or strength of contraction at the heart. And then beta 2 causes arterial dilation at the muscle tissue level. So in effect, what this does is it increases cardiac output because you have increased heart rate and increased strength of contraction with decreased resistance, kind of a bigger pipes and the pump working harder. So it's going to make blood flow very quickly. The prime instance of use for dobutamine is if somebody has a high lactate, for instance from sepsis, and you can't give enough fluids to counteract that, then you would put them on dobutamine because it increases their cardiac output and will deliver more of that lactate to the liver where it will be gotten rid of. So, and it's also sometimes used for cardiogenic shock. But of course, because it stimulates beta 1, anything that stimulates beta 1 is going to lead to the increased likelihood of arrhythmia. So you always have to be wary of that when you're picking an agent. So the second pressor we're pretty familiar with. This was kind of the go-to drug for the last 20 years, probably, dopamine. And we use it to chemically overcome bradycardia, and we use it in decompensated cardiogenic shock. It stimulates beta 1. So again, it's going to increase your heart rate and increase the pump squeeze or the strength of contraction. But it also causes some alpha 1 activation, and that means it's going to increase your peripheral vascular resistance or your blood pressure. So it's used, again, for whether it be septic shock, any kind of shock. But the reason that we have gotten away from using dopamine in septic shock is because it increases your heart rate. And generally speaking, if you've got a sick person with septic shock that you're going to be, you need to initiate a pressor. You want to elevate their blood pressure. In all likelihood, their heart rate is already elevated. So let's say you take someone with a heart rate of 120 with a blood pressure of, 80/60, and you put them on dopamine, well, you're going to probably increase their blood pressure, but their heart rate might be 140 by the time you're done. And so that's not really healthy either. And that high heart rate is going to, again, predispose them to arrhythmias. And so that's why typically now we go with a different agent. Epinephrine, we use this pretty frequently both for kids and then as a pressor. We talked about epinephrine just in the fight or flight response with activation of alpha 1, beta 1, and beta 2. We use it as a side note, we use it for anaphylaxis, but we're not going to be probably using that as a drip for anaphylaxis. But anyway, again, just to go over again, epinephrine stimulates alpha 1, beta 1, and beta 2. And so by doing so, when it stimulates alpha 1, it's going to increase your blood pressure. By stimulating the beta 1 receptor, it's going to increase your heart rate and increase the squeeze of contraction. And then by stimulating beta 2, it's going to divert a lot of that blood flow by opening up the arteries in the muscle tissue. It's going to divert blood flow there and help with that fight or flight response. So again, its uses are hypotension and anaphylaxis, and it's the preferred pressor in children because even though it stimulates and elevates the heart rate, kids handle that very well and typically don't have arrhythmias related to tachycardia. Norepinephrine is also called Levophed, and people who have been in hospitals and around for a while also know the medicine as leave 'em dead. Levophed, leave 'em dead, they say, because by the time they're on Levophed, their situation is pretty dire, and a lot of times they're circling the drain. Norepinephrine affects alpha-1 receptors more than beta-1, and it really doesn't activate beta-2 at all. So primarily you are increasing the peripheral vascular resistance, which is your blood pressure, and you're minimally affecting heart rate and contractility. So it's an ideal agent for sepsis. Again, if you take that patient who has a heart rate of 120 and a blood pressure of 80/60, and you put them on norepinephrine, it is going to elevate their blood pressure, which is exactly what you want, but it's not really going to affect their heart rate. And norepinephrine has very little arrhythmogenic or arrhythmia-causing potential. So again, it's the preferred pressor in septic shock, and I expect that of all the pressors, you'll see this one the most, even though it's often called leave them dead.